And I'm going to put everybody on a separate screen, so I can kind of see your faces if you wave or put your hand up, etc. But obviously, so if I'm not looking at you, I'm looking at you because you're on a separate screen. Just FYI. It's not that I'm just trying to avoid eye contact. So what I'm going to talk about today is just some experiments we've done over the last few years, examining this issue of how does the nervous system control stresses and strains within joints, and kind of primarily just trying to highlight the idea that this might be an important topic in motor control that's often kind of been neglected in the context of the neural control of movement. These are things that are obviously very important in the context of injury and sports, medicine, sports mechanics. But I think in the context of the neural control of movement, they've gotten a little bit of short shrift, right? So we've done some experiments in animal models that Mark's referred to that I'm just going to walk through today. And I just wanted to highlight, this is the work of two really good postdocs in the lab who've now moved on to bigger and better things. Cristiano Alessandro, who's now in Milan, doing work there. And then Felipe Barroso, who's in Madrid, continuing to do rehabilitation work now in humans there. As both of these are in postdoctoral positions now. And then also just acknowledging funding from NIH. Okay. So the starting point for this is kind of, the basic question that I think a lot of us in the Zoom room care about is how does the nervous system control muscles or activate, the plant that's actuators to produce behaviors, right? And I think the common way of thinking about this is how does the nervous system activate muscles to achieve a task, right? So in this kind of context, if we're thinking about kind of leg movement, right? So we have torques at the joints, at the knee joint, or kind of limb kinematics. And we figure out how do we activate the muscles to produce the desired torques or the desired limb kinematics so that we can walk from point A to point B, so that we can go and reach out and grab a cup of coffee. Whatever we need to do, that's being specified by the task constraints, right? And this is kind of, I think, the standard way we think about things in the context of motor control. But in order to produce a task, right, in order to actually move the limb, we need to act through joints, right? Almost all movements we make are being produced through muscle activations through joint structures. And joints are, we usually think about these as kind of like, revolute points or like ball socket joints. And some joints work like that, so the hip kind of is like a ball socket joint. But even that's kind of a simplification. And then we get to joints like the knee joint, which is just, I did a dissection with one of our collaborators, Yassine Dar, on this, and he walked me through the knee joint and, just in a rat. I mean, it's a similar structure to the humans, obviously, and it's incredibly complicated, right? So anybody, those of you who are doing kind of revolute joint simplifications of kind of the knee or elbow, take the dissection of the knee joint, it's, there's no joint there. It's basically just a couple of bones connected with soft tissues, ligaments and tendons, and with cartilage between them, right? And it's a really beautiful mechanism of how these different parts interdigitate with each other and how they move, evolve over different configurations of the joint. And so the fact that the knee can move in some degrees of freedom and is restricted in others, it's not because there's a pin going through the joint. It's because we have these ligaments that prevent movement in different directions, right? And so in order to produce these kinds of the limb kinematics or achieve a task, muscles will act through this joint and will cause differential stresses and strains within the joint and deal with those variables, those kind of hidden variables, right? So you can think that there would be many different ways to achieve a particular kinematic movement, right? To walk or to reach and grab an object. And those different patterns of activation might cause differential stresses and strains within the joints, even though those stresses and strains have no impact into terms of task performance, right? Those two different patterns or those different patterns achieve the correct task performance goals, but they could come at the cost of aberrant stresses and strains within the joints. Potentially with multiple repetitions, this could precipitate injury, lead to degradation of the cartilage, things like this, right? And so the question we've kind of had is just, can we show in an experimental model that the nervous system cares about these variables, that it actually incorporates them and with the demands of the task? And then the follow-up experiments are kind of now asking, how does the nervous system actually monitor these stresses and strains, with the idea of then taking this paradigm and going into the nervous system to try to understand what's the neural circuitry involved in this control, right? So these are experiments that we've done in rats, and we focused on control of rats at the knee joints, right? And we took this because we did some experiments. So kind of our starting point to this whole thing was that we kind of came into it naively, right? This is not something I kind of, come from the neural control of movement point of view of just thinking about task performance. And so the idea of joint stresses and strains was very foreign to me. But we did these experiments trying to characterize actions of muscles and how they contribute to task performance, building a biomechanical model for the rat hind limb. And we did these experiments stimulating muscles in situ and then measuring the forces and moments produced across the skeleton, right? So these are experiments we did. We attached a force transducer to the distal tibia of the rat. We clamped onto the pelvis, and then we activated stimulated either vastus medialis or vastus lateralis. These are two of the quadriceps muscles, okay? And what we saw is that these muscles produced nearly identical endpoint forces as well as moments at the tibia, right? So really, and so this is just to kind of show you, this is the black arrows are the forces evoked from stimulating VL. The red arrows are evoked from stimulating VM. And then we put the leg into a new position, repeated the stimulation, and then moved the limb to different parts of the workspace and repeated the stimulation between the two muscles. And you can see that these forces align really almost identically here, right? There might be a small change, but they're very similar to one another. So from the point of view of task performance, the point of view of kind of saying, how do you go and walk, produce the joint torques necessary to walk or kick a soccer ball or something like that, these muscles are completely redundant. You could swap one for the other and achieve equivalent task performance, right? So this is kind of, from the point of view of degrees of freedom and so forth, this looks like these muscles are kind of superfluous and redundant to the task requirements, right? However, if you go in and you attach a force transducer to the patella, these muscles, because they're inserting from either the medial side or the lateral side, they produce differential medial-lateral forces on the patella, right? So these are the force vectors evoked from stimulating either VL or VM. And you can see the main action of these is to pull the patella proximally towards the hip, right, as you would expect. But the VM has a medial force component and VL has a lateral force component. So from the point of view of the stresses and strains that are imposed upon the patella, these two muscles have opposing actions, right? And notice that these actions essentially are hidden, right? They do not affect task performance because by the time forces are transmitted to the tibia, these differential medial-lateral forces are suppressed. And we are able to show that this is really because in the rat, the patella is locked in the femoral groove, okay? And so the transmission of forces from the patella to the tibia is identical for the VM or the VL in these cases, right? So even though these muscles have identical task contributions, right, what they have is these opposing internal joint stress and strains contributions, right? And this is, people have been studying these kinds of things in humans for a while, right? And, the difference here is that in rats and in animals, because of their crouch posture, it really enables this really clean distinction between having these identical task performance contributions in terms of their endpoint forces and these distinct medial-lateral forces. In humans, because the patella can float for a lot of cases of extended, when your posture is extended, because of that, when you stimulate one muscle or the other, you can potentially move the patella to one side or the other and cause different forces at the endpoint, right? And so you don't get this clean kind of distinction between task performance contributions of these muscles and internal joint stresses and strains contributions, okay? So this is just kind of summarizing what we have here. This is our kind of biomechanics that I like, where you don't have to really do very complicated modeling. It's just really relatively qualitative biomechanics. We have this idea that we have our quadriceps muscles, VM and VL, that produce essentially the same torque across the knee joint, okay? And so in that kind of context, their task contributions are identical. However, from the point of view of their internal joint actions, how they how they put medial lateral forces on the patella, these muscles have opposing actions, right? So this gives us this clean kind of conceptual distinction between how these muscles act on task variables and how they act on these internal joint variables. Just to complete the picture in terms of the quadriceps muscles in the rat, if you stimulate rectus femoris, what you get is a knee extension torque, but rectus femoris also has a hip flexor torque, okay? So rectus femoris does not have the same task action as these vasti muscles do, okay? And moreover, rectus femoris will pull relatively straight upon the patella, and so it won't cause a medial lateral load on the patella, okay? Another quadriceps muscle is vastus intermedius. In the rat, this is a pretty small muscle. It's sitting right underneath rectus femoris. It's relatively thin, relatively small mass, but it's also monoarticular, so it has the same task action as the other vasti muscles, producing a monoarticular knee extensor torque. And because it's sitting kind of right along the midline, it has relatively little medial lateral force on the patella as well, okay? So this is essentially kind of the biomechanical, our really simplified biomechanical understanding of the actions of these muscles, okay? So we can kind of characterize them in terms of their task actions and their internal joint actions, and then use this framework to make some predictions and do design. Okay? Any questions about that overall starting point? Because it's kind of the frame straightforward, and those of you who have done human work, obviously this is things that are kind of familiar in human literature as well. Okay? Okay, I'll just keep moving then. So I'm going to talk about three main experiments to kind of show that the nervous system cares about medial lateral patellar forces and regulates muscle activation to do this. And then I'll talk, if there's time, more recent experiments we've been doing to look at kind of the substrates or how the nervous system might monitor these forces. Okay. So the first set of experiments we did was simply observational. And really just asking, how does the nervous system activate these muscles during behavior, during locomotion? So the idea here is, again, this is ideas that have been talked about in human literature for a while, is that, the idea that if VM and VL, because they produce opposing medial lateral forces on the patella, right? If the nervous system cares about joint stresses, then we should see a really tight coordination between the activation of these two muscles, right? So anytime VM goes up and produces a medial force on the patella, we should see VL go up as well to produce an opposing force to try to balance the net medial lateral forces on the patella, okay? So we should see that VM and VL should be strongly correlated, but then the correlations of these muscles or any amongst the other quadriceps muscles should be relatively lower, right? Because we don't need them to be correlated in terms of monitoring the medial lateral forces. That's in the context of regulating joint stresses. If we think about the nervous system coordinates muscles to simplify task performance instead, right? An idea of kind of reducing redundancy. So this is this idea of, kind of muscle synergies, which I know I've been a part of in the past as well. And we can think about this in the context, if VM, VL, and VI are all producing a monoarticular knee extensor muscle, and the nervous system wants to somehow simplify control, then the idea would be that you should control all three of these muscles as a unit, right? To simplify the degrees of freedom, to make it just kind of control a simple knee extensor muscle kind of unit or synergy. Then we should see that there should be a tight correlation between VM and VL, but also a correlation between VM and VI and VL and VI as well. And that the correlation between all of these sets of muscles should be similar to one another. So this is kind of, again, a relatively simple-minded prediction that we could make based upon these two different ideas. If the nervous system is trying to simplify task performance, we should see tight correlations between all three muscles. If the nervous system is primarily trying to coordinate, not necessarily primarily, but is coordinating, regulating joint stresses, we should see a preferential correlation between VM and VL and weaker to the other ones, okay? So we just do this in rats. We have chronic EMGs implanted in several muscles. I'm just going to focus on essentially the quadriceps muscles here. Here's the four heads of the quadriceps, VL, VM, VI, RF. During locomotion, I just have ellipsoas here to give you the flexor phase for the walking cycle here. And you can see that there's kind of a stereotypical pattern here, so that the vasti, VM and VL and VM kind of have this ramping up activation. So they are weak at the beginning of stance, and then they become larger towards the end of stance. VI is active during the stance phase, but it has kind of more of a flat kind of recruitment pattern here. And RF shows a kind of stereotypically biphasic activation with both a burst that's similar to the vasti, but then also a very strong flexor burst, swing phase burst as well. So we were primarily interested in the activation of when these muscles are active during stance, because all four muscles are active at the same time. So that gives us the strongest place to look at the coordination between these muscles. Okay. So the first thing we noticed is just simply when we looked at the activation of these muscles across different task conditions, we saw things that suggested coordination patterns consistent with the controller joint stresses, right? So we have these animals walking on treadmills. They can walk at different speeds, so 10 meters per minute, 15, 20, or at different slopes of the treadmill, either walking at a down slope, at level, or up slope, okay? So across these different task conditions, the activation of these muscles change, to accommodate task performance. But what we can see is that if you look at VM and VL and VM activations are in blue and red, you can see across all these task conditions, VM and VL track one another quite well. These are averaged across steps and across animals. And you can see again that when you go across different slopes of walking, you see the activations change across all four muscles, but the activations of VL and VM change together, right? So even though VI will go from being active, a little bit active here, it gets increased here, so it's changing as well. It's changing independently from VL and VM, okay? So this is the kind of first observations to suggest that VL and VM are being coordinated together and independently from these other muscles, and in particular independently from VI. So this is the average activation across task conditions, right? These are averaged across all steps and across all animals. What we also wanted to ask is if you look at kind of the variations from step to step, how does this work as well, right? So what we looked at here is kind of taking, for one animal, we took each individual step, looked at the integrated activity of each muscle during the stance phase, and then each dot here is one step of the locomotion. So this dot is saying we have this much VL on that step and this much VM on this step, okay? And then all the other dots are just other steps that we looked at during locomotion. And what you can see is that there is a correlation between VM and VL here, right? And it's relatively tight. In this case, it's a correlation of 0.78, right? So that in general, when one muscle goes up on one step, if VL goes up on one step, VM will go up on that same step. Or when they go down, they'll go down together. When we look at the correlation of the other muscles, so this is the other vasti as well as the vasti to rectus femoris, we can see there is some correlation, but it's not as strong. Okay, so there's a bigger cloud of relationships of activation between VI and VM here. Okay, and then it's weaker still between VM and RF and VLRF, etc. Okay, and then this is just plotting the results across all animals, and again looking at different task conditions. So this is the x-axis is showing the different correlation pairs. So VL VM is the leftmost one. And then we have these ones are between the other vasti, and then from the vasti to the rectus femoris here are the last three. And what you can see is that across all task conditions, VM and VL are correlated quite strongly. This is the correlation coefficient. So it's 0.8 on average is kind of where this is. And then importantly, this correlation is higher than the correlation of the VM or VL to the other vastus muscle, VI, okay? And that this relative preferential strength of correlation between VL and VM is observed across all these different task conditions, okay? So what it's suggesting is that this covariation between VL and VM is most consistent with the idea that the nervous system is coordinating these muscles to regulate the medial lateral forces on the patella, rather than simplifying task performance, right? Because the correlation of VM to VI and VL to VI is consistently weaker, okay? We also looked at kind of, those were all during stance. We did look during swing as well, when we had enough activation in each of the muscles during the swing phase. And we saw that the correlation during swing phase was between VL and VM was a little bit lower than it was during the stance phase. It wasn't a huge difference, but there was a consistently lower correlation. And this might make some sense, that the idea is that you really want to stabilize these forces on the patella when the limb is in contact with the ground. because that's when you're most likely to get destabilizing interactions that might cause a dislocation of the patella or aberrant medial lateral forces, etc. That's kind of tasks where you really want to kind of correlate these muscles and coordinate them closely. Okay. So it's just kind of suggesting that it might not be a completely fixed and stereotyped coordination, but might be somehow being modulated in reference to the task demands. So that's kind of the first set of experiments, which are, again, just correlative, just observational, to suggest that the normal patterns of variation of muscle activations during behavior are consistent with this control of joint stresses and strains, okay? I can take any questions, just stopping to allow for people to jump in. Not that I need them, just trying to see if wanted to encourage conversation.
Well, Matt, there was a question. It's a specific question about possible mechanoreceptors that would inform the central nervous system about the contact forces within a joint that could be used to drive the mechanisms that you're describing.
Yeah, so those are essentially, that's the final set of experiments we're going to get into, is kind of like for this particular case, kind of how is this coordination actually accomplished? Is it accomplished by sensory receptors that are monitoring the load on the patella and then kind of feeding that back in a direct way? And that could be, directly through contact forces potentially, although what those receptors are a little bit unclear, or it could be through proprioceptors in some way, that the muscles to do that instead. The alternative as well is that this is done through feed-forward coordination, where the muscles are being activated through pre-motor networks to kind of instantiate this particular coordination. So those are things we're going to try to get to that are kind of our next steps. We've done some experiments on this already that kind of argue for some things, but maybe later in the talk we can come back to that conversation. I think it's a really interesting question, and I don't have a definitive answer, but we've started to look at these issues. Okay. Okay. Yeah, Anatol.
I ask the question. So, let us accept that most of muscles, skeletal muscles, and external ocular muscles, eye muscles, are controlled by shifting the pressure the muscles start activating. Okay? And so my question is, when you change lambda, so the general mechanical characteristic of the system shift in spatial coordinates. Okay? And my question, is there any simultaneous shift in stresses of connective tissue and ligament and so on? There is I'm interested in general principle. Okay.
No, absolutely. Yeah. I think that it's actually an interesting. So I think about this in the context of equilibrium point, in the context of kind of reciprocal commands versus a coactivation command. And what's really interesting, I think, in this particular situation, is that the coactivation command that you have here. So usually it's, this kind of coordination between the two muscles, between VM and VL, essentially is a coactivation command that just kind of essentially stiffens up the patella, right? It kind of gives you potentially so it does two things. It balances the forces on the patella, and it potentially gives you a stiffness that will allow you to respond to minimize perturbations that would be imposed upon it. So in this kind of context, I think, as a general point, obviously, I think anytime you change the way muscles are activated by shifting lambda or other ways, because of the muscle actions, they will affect both task performance and potentially joint variables, right? And that's just the mechanics of the limb. That's going to be the general case. I think in this particular case, we have essentially something that is this coactivation command, which, what's kind of interesting about this is that you can coactivate these muscles and you can do it without really an energetic cost, right? Because you can basically just say, usually when you think about coactivation of muscles, you're doing that in a way that's kind of in a null kind of or adding unnecessary activations to achieve the task. In this particular case, you can distribute the activation of these muscles between VM and VL to achieve the torque that you want. And you can do it in such a way that you also get a coactivation command to reduce perturbations, right? So in this kind of context, you can do a coactivation command without really without a penalty in terms of task performance. I'm not quite sure if that answers your question.
But yes, thanks. But I would like to notice that it's not a question, not only the question of coactivation, but if you return to the EMG pattern of all the recorded muscles during locomotion, what I see some global factor. I see, yes, this.
I'm not sure what my mouse is doing. I'm sorry. Go ahead.
A very distinctive global minima at certain phase of locomotion cycle. It's if you take the cursor and put in certain sense, you see all of them, all EMG is minimized. And this tells me, at least to me, that all these muscles control globally by changing referent body configuration, referent joint configuration. Okay, and so which shows global configuration in terms of reciprocal command. Okay, so we need to consider a couple of commands: cultivation and reciprocal cultivation. Okay, so maybe we discuss after this possibility. Okay. Okay. Thank you.
Yeah. No, that'd be great. Definitely. I think.
Yeah. Okay. So, Matt, we will definitely discuss it because I think it's an exciting topic about agonists having kind of two-dimensional commands. So, in one dimension, it is joint, and the other dimension they act as an agonist and antagonist muscle, and then you can introduce the coactivation command suddenly, and then maybe with experience or with evolution, we find out patterns that lead to this coactivation command being at a certain level at all times. But there is also a question whether VM and VL also cause rotational force in the frontal plane.
So at the level of
rotational effect. Okay,
yeah.
Moment. Mm-hmm.
So they do have moments at the tibia, right? Mm-hmm. So when we put our force transducer at the tibia, we do get rotational moments. So they will cause that, but the point is that they don't cause differential moments. So in the rat, at least, because of the fixed patellar situation, we don't see a difference between VM and VL. So although their contribution to task performance isn't trivial, like when I say it's just kind of a knee torque, I'm not just saying it's knee extension, and that's the description of these muscles. I think they do other things out of, that can cause rotational things depending upon.
But in the frontal plane, the question is about the frontal plane.
In the rat, the abduction-adduction degree of freedom is relatively stiff and constrained. So we don't really see too much of a moment there at the level of the tibia. We can see a supination-pronation moment. So the rat's tibia can actually pronate-supinate a little bit. And so depending upon the patellar angle to the tibia and where that is, that can cause a rotational moment at the tibia as well. Okay. So
thanks. Mm-hmm. Yeah. Sure. Good. So, all right, you'll probably continue.
Okay, sounds good. Okay, so our second set of experiments, our next two experiments are doing kind of perturbation analyses, right? So we're trying to here now go in and perturb the system in some way and see how the system adapts to these perturbations, right? And the idea is we want to introduce perturbations that will compromise either joint stresses and strains or task performance or some combination of the two, and then see how the animals adapt, okay? So for this one, what we did is here is the kind of, in some ways, the straightforward kind of, at least conceptually, experiment. We just put a lateral load onto the patella, okay? And the idea here, and this is kind of equivalent if you were to, when you tape the knee, right? So people do these, if you have ways where you can actually tape the knee and cause, put out a load onto the patella that way in people. In rats, we can't really tape the knee. So what we did instead is actually put in bone screws, and I'll describe that a little bit. But the idea here is quite obvious that if you put a lateral load onto the patella, what you should see is a change in the balance between VM and VL, right? So that you should increase activation of VM or decrease activation of VL so that the net medial lateral forces on the patella are minimized, right? Or at least reduced. Minimized is a stronger statement than I can say, right? Whereas the activation of other muscles like rectus femoris and VI, which don't really contribute to the medial lateral force in the patella, should be relatively unchanged, okay? So this is what we did. And like I say, we did this in kind of straightforward but difficult experiments. So we put a bone screw into the patella, and we put a bone screw into the lateral femur. Okay, and then what we did is we inserted those screws and we put in the EMGs, and then we let the animal recover and get baseline EMG patterns. Okay, so at this point, the screws are implanted, but no perturbations have been applied at this point. We then do an acute surgery, really quick, relatively quick surgery, and attach a rubber band between these two screws. Okay, and because the screw in the femur is lateral, on the lateral part of the femur, this will cause a lateral load to be imposed on the patella. Okay, and we can then leave that on for 1 to 2 weeks. Okay, and see how the animal recovers, how it adapts to that change of the load. And what's nice about this is that we can then go in and we can cut the spring and look at de-adaptation as well. So we can look at kind of how does the animal change in response to this lateral load, and then how does it change back after the load is removed, okay? So here's just an example of one animal for this, right? So here we have VL and VM across 3 steps, looking at these muscles active during 3 steps of locomotion. This is with no spring. We then attach the spring. And what you can see is what happens here is that VM is relatively similar, activation of the muscles across it after the spring is attached. VL activation, however, goes down, okay? So there's a reduction of VL activation here. Okay, and this is consistent with this idea of adaptation of medial lateral loads, right? Because we put a lateral load onto the patella, and what we're getting is that the activation of VL goes down in compensation to, which will cause, the reduction of VL will cause a reduction of the lateral load on the patella so that the medial lateral load, the net medial lateral load on the patella will be reduced, right? We then go in and cut the spring, and what we see is that VL goes back up. VM in this animal actually goes back up a little bit as well. Okay, it's a little bit higher here compared to here. But the ratio between VL and VM is closer to what it was initially than when the spring was attached. Okay, so we're seeing the ratio between VL and VM change in such a way to reduce the net medial lateral load on the patella. And this is what we observed across animals. So this is the ratio between VL and VM, okay, across these conditions. We normalize it to the pre-spring attached case, that's what 1. And then we attach the spring, and we can see that the ratio between VL and VM goes down, right? So indicating that there's more of a net medial force, muscle force that's being produced when the spring is attached. Again, the spring is producing a lateral load, so we have more of a medial force to compensate. When we detach the spring, it goes, the ratio goes higher again, okay? It returns to a level that's not significantly different than the baseline condition, but it goes up to a level that's significantly different than when the spring was attached, okay? So this decrease of this ratio is consistent with minimizing medial lateral patellar force, okay? What was interesting is that we saw that this change in the ratio seemed to be primarily due to a reduction of VL rather than a change or an increase of VM, right? I think our first prediction when we did this, we expected to see that VM activation should go up, right? Because we're adding a medial load to the patella, but instead we saw this reduction in VL, okay? In retrospect, this might have, the way we interpret this at least, is that when we attach this spring, we're not actually producing a pure lateral load on the patella, right? Because we can't actually put a screw on the femur so that it's only giving a lateral load on the patella. This screw is actually placed a little bit proximally onto the femur, And so it's actually producing a extension, it's pulling proximally onto the patella in addition to laterally as well. And so this will cause a net kind of knee extension torque to be imposed kind of as a background level. And so this kind of reduction of VL in this sense, rather than an increase of DM, is consistent with this idea that there's a bit of an extra knee extension torque. And the way that the nervous system is compensating for that extra knee extension torque, as well as the lateral load, is to reduce activation of VL. Okay, so that's kind of...
Matt, sorry, could you clarify a couple of things? So the first one, as far as I understand, between the no spring and spring attached condition, there is a significant period of recovery, or is it nearly instantaneous? And the second one is that after you cut the spring, I assume that there is no adaptation at all, right? Or is it? Is there?
So
what
we
are
didn't...
the time intervals?
Yeah, so we looked at that a little bit. So here's the cases. We looked at the ratio immediately 2 hours after attaching the spring versus 3 to 5 days. So the data that I showed you before was with like 3 to 5 days within 1 or 2 weeks after the change, right? So 2 hours after we attached the spring, we did not see a change in the ratio. Okay, so it looks like that this adaptation, this change of the balance of the muscles, was not an instantaneous kind of adaptation, but took some time to develop. We didn't have enough data points after the deactivation, after detachment, to ask your second question, to be able to look at how immediate was that. In the animals we had, it looked like it was not an immediate change, but it took some time as well. Okay, so this at least...
Time, you mean minutes, hours? Like if you compare with 2 hours or days?
It seemed like it was days. Oh. It seemed similar to the attachment kind of time course.
So it is adaptive, probably. Yeah.
Well, so there's several issues with this interpretation. There's some things that complicate this, right? So one idea, and the kind of our first interpretation, was that this suggests, like you're saying, that this is an adaptation process. It's something similar to like, force field learning or prism adaptation, where you put the perturbation on and it takes some time for the animal to recognize there's the perturbation and adapt muscle activation patterns to accommodate for it. So one first issue with that is that at this 2 hour time period, because we have to, because of our protocols and so forth, we're giving the animals analgesics. So the animals here have NSAIDs. We do that for 2 days after this intervention. And so they still have perception, but they, I don't have pain perception. So if pain is part of what's driving this the change in muscle activations, we would not be sensitive to it at this 2 hour time point, right? So that's one kind of point. The other point here that, again, this was very naive on us, and a reviewer pointed out when we published the paper, is that what could be happening here is not necessarily a gradual adaptation process, but a gradual inflammatory process. And so what we could be having is, when we put on this load onto the patella, is that we cause a change of the force, but then only over time, when we have this kind of aberrant force that's there kind of for chronically, what happens is that some sort of inflammatory reaction happens because of that aberrant stress on the patella. And then what we might be seeing is that because of that later inflammatory process, now we get the reflex that kicks in at a later time point. And that's why by 3 to 5 days, we see the change, but at 2 hours, we don't. So we can't really distinguish all of those possibilities right now. Okay. So it's a really interesting question, and we'll come back to it a little bit towards the end, where we go in and what we do. Basically, we have experiments that we're going to do is we inject lidocaine into the joint and start looking at how that affects activations of muscles, either intact or in response to injury and so forth. Okay. But it's a really interesting question. We don't have a definitive answer for it. So, but what it does suggest is that the nervous system does seem to care about these medial lateral loads, and it changes muscle activation patterns to compensate for perturbations in this medial lateral load. The third perturbation experiment that we did was a little bit more complicated. And I think, it's, anyway, a little bit more complicated, but I think potentially kind of is interesting because it kind of really puts task performance up against joint stresses and strains, and gives us a way to interpret that results that might otherwise be relatively difficult to understand. Okay. So what we're going to do here is the perturbation we're going to do is paralyze vastus lateralis. So we're going to basically get rid of one of the muscles and look at how the nervous system adapts afterwards, right? So this is just a cartoon to, again, the kind of really simplified kind of conceptual biomechanics that we're going to be using to frame our experiments. So if we think about kind of our baseline behavior with everything intact, we've got our quadriceps muscles. I'm not showing VI here. VI would be kind of underneath rectus femoris. And you can kind of think about it similarly, except that it only has a monoarticular knee extension. But in terms of their actions, right, DM will pull medially on the patella, rectus femoris will pull relatively straight, DL will pull laterally. At the level of task performance, in terms of the net joint torques, we will have, some sort of net activation. We're going to activate these muscles, quadriceps, in some sort of distribution, and that will give us a combination of knee extensor torques as well as hip flexor torques due to rectus femoris activation. Okay, so this is what's happening at the level of joint torques. At the level of our joint variables, this medial lateral load on the patella, the idea is that we'll have somewhat balanced activation between VM and DL that will give us kind of opposing medial and lateral forces on the patella, so that we'll have relatively small net medial lateral forces on the patella. Rectus femoris and DI will pull relatively straight and give us less medial lateral load, okay? So this is our normal behavior. We're achieving task performance while kind of minimizing medial lateral forces on the patella. We can then go in and we cut VL and DM. I'm sorry, cut VL and paralyze. So we're going to cut the nerve to vastus lateralis to paralyze this muscle. This will cause a subtraction or elimination of this force from VL, which will cause a reduced extension torque at the knee joint. The hip torque will be the same, right? Because that's just coming from rectus femoris. And then we'll have an imbalanced load on the patella, okay? And then the question is, how does the nervous system adapt to this perturbation, okay? So if the nervous system really only cared about task performance, what we could predict is that the easiest way for the animal to compensate would be just to increase vastus medialis, right? So because vastus medialis and vastus lateralis have the same contribution to task performance, this would give you immediate compensation, right? You would restore the knee extension torque, the joint torques that you had before, and you could achieve task performance as you did before the paralysis. However, this would obviously come at the cost of a strong imbalance of the medial lateral forces on the patella, right? You would have increased activation of VM, which could give you a very large medial load on the patella. And so you'd have compromised your joint stresses and strains in this kind of adaptation strategy. If the nervous system really only cared or really strongly cared about the medial lateral force on the patella, then after you cut VL, what the nervous system might want to do is basically shut down activation of VM, right? Because then you would have minimal medial lateral force, net medial lateral force on the patella, okay? And you could restore the knee extension torque that you had, right? And you would do that by preferentially increasing rectus femoris, right? So rectus femoris would allow you to, basically, because it produces minimal medial lateral force on the patella, that would give you control of those joint stresses and strains. But what would happen is that you would increase your hip extension, hip flexor torque here, right? Because you would be caught, and because rectus femoris has these two actions at both the knee and the hip. So this strategy, although minimizing your stresses and strains in the joint, this would cause compromised task performance, right? Because you would have this aberrant torque at the hip joint instead, okay? So instead, if the nervous system did something to kind of balance between these two, what we would expect to see is a preferential increase of rectus femoris, right? So rectus femoris should increase to kind of minimize the net medial lateral forces on the patella, but the nervous system might not get rid of VM entirely, right? It might find something that kind of compromises between these two solutions, right? So that it would increase rectus femoris, but it might not get rid of VM entirely because it didn't want to create too much of a perturbation in terms of task performance, okay? But the idea here is that if we see this kind of signature, if we see increased activation of rectus femoris, it would be really suggestive that the nervous system cares about medial lateral forces on the patella. An increase of rectus femoris doesn't really make sense if the nervous system really is prioritizing task performance because of the extra hip flexor torque. Okay. So with this kind of logic in mind, we went in to do our experiments. So we have animals, again, walking on a treadmill. We focused on kind of upslope walking because that gives us the strongest activation of these muscles. So it would be the most sensitive to changes. we then would go in and cut specifically the nerve to vastus lateralis, okay, to paralyze this muscle. Okay, so we do this, we have some basic treadmill training of these animals. We establish a baseline pattern of EMGs. We then cut the nerve to VL, and then we monitor the activation of these muscles over time for up to 7 weeks after this paralysis to look at how they adapt. And then at the last time point, we then also look at muscle mass as well. So first thing is just to say that derivation works as we thought it should, right? Which is kind of nice, I mean, good confirmation. So this is baseline activation of VL. Here we're showing tibialis anterior just to show you the alternation during walking. We cut VL here, and TA continues. We're seeing the ankle flexor muscle, and the activation of VL goes down dramatically. There's maybe some residual EMG here, which could either be, a residual innervation of this muscle. We can't exclude that maybe a branch is giving us some innervation of this muscle that we can't get rid of entirely, or it's potentially a small crosstalk or maybe motion artifact. We can't really eliminate those possibilities, right? But in general, if we have our baseline activation of EMG, of VL, it goes down at week 1, that's the red line, and it stays down over the time of our intervention. So we're not seeing reinnervation of the muscle either, which is an important control in this or important observation as well. And then, what we do see as well is that the knee, the angle of the knee, we see that there's basically yielding at the knee joint immediately after this cut. The range of motion goes down after this cut. And then importantly, when we measure the mass of the muscles at the end of the experiment, we see a significant drop in the mass of VL as well for the side that is cut. Okay, this is the intact side, the mass of VL. On the cut side, it goes down quite a bit, right? So we're able to get this kind of specific denervation of VL. I'll show you as well the mass of the other quadriceps. We didn't see a similar decrease in the mass of those muscles. Okay. First thing to say is that rather surprisingly to us, animals really didn't mind this perturbation very much. We could just go in, and although we've gotten rid of VL entirely, animals, really quickly after this injury, we tested them, I think certainly within the first week, but I think it was usually like 5 days after the surgery or so forth. And there was initially there was a change of the stance phase, okay? But I mean, the first thing to say is that animals could walk on the treadmill. It wasn't like they just refused to walk or they had such huge deficits that it was impossible. So there was some sort of change in the stance phase. There was a change in the yielding, the range of motion at the knee joint, okay? But then over the course of the weeks, the animals adapted to this so that their percent stance phase, percent of stance swing phase kind of went back to normal levels, or at least not indistinguishable levels from the baseline conditions. So initially they essentially were kind of limping, right? But then quickly afterwards, they no longer did. The range of motion at the hip and the ankle went back to levels that were indistinguishable from baseline. There was a persistent decrease in the range of motion at the knee that persisted over 7 weeks, but you can see it gets back to relatively similar levels, right? So the basic idea, though, is that animals are able to achieve task performance, to walk on the treadmill across in this upslope condition after we get rid of one of these muscles, right? So then we looked at the pattern of how the animals recovered this, right? And looked at the activations of VM and rectus femoris at different time points during this adaptation. So this is just rectus femoris and VM in the baseline condition in blue here. Initially, at the first week, we see a dramatic increase of both rectus femoris and VM during locomotion. So the increase of both of those muscles go up, okay? And then over time, what we see is that VM activation goes back to levels that are similar to what it was before in baseline conditions. But rectus femoris, although it goes down, this is this should be week 7. This is a typo I always, that should be corrected. It goes down compared to week 1 here, right? It's still elevated compared to what it was during baseline conditions. And this is just showing you the averages across step cycles for each of these time points. So blue is the baseline condition. This is rectus femoris. This is VM. So you can see in week 1, the red activation. The red in week 1 activation of both of these muscles goes up quite a bit, right? But then over time, what you see is that the activation of VM goes back to levels that are very similar to what it was in baseline, right? So this yellow is week 7. You can see there's a slight elevation of activation of VM, but it's quite close to what it was before. In contrast, there's a much larger activation of rectus femoris, increase of activation of rectus femoris that persists over this time period, right? Okay, and that's what we saw across our animals. So this is just showing you the average of the integrated activity for rectus femoris and VM. These are normalized to our baseline condition. So a baseline of 1 is our base activation before paralyzing VL is at 1. We can see that in weeks 1 and week 2, there's an increased activation of rectus femoris here. A little bit of an increase, but it's not significant of VM, okay? But basically VM activation doesn't change significantly across these time points. In some animals, the animal I showed you, the VM activation went up. Other animals, VM went down in these initial time points here. But by the time we get to week 7, VM is basically, VM activation is indistinguishable from the levels it was before the nerve cut. Instead, rectus femoris remains elevated relative to baseline, about twice what it was in the baseline levels, okay? So even though there's a large increase of rectus femoris and it comes back down, it stays at a level that's elevated compared to what it was in the baseline conditions, whereas VM does not seem to change over this time course, okay? So what we're seeing is this preferential increase of rectus femoris activation, which is consistent with this idea that the nervous system is choosing an adaptation strategy that minimizes, that it's, in order to restore the lost task actions, the lost actions of VL, the animal is increasing rectus femoris to restore that lost torque, okay? Even though, and that makes sense in the context of minimizing medial lateral loads on the patella, even though it potentially complicates task performance by introducing a hip extension torque. Okay.
We have a couple of questions, Matt, that directly address this experiment.
Yeah.
The first one is whether there was a change in the attack angle and trajectory of the affected limb to compensate for the paralysis of VL.
So the attack angle in the sagittal plane or in the
I assume it's in the sagittal plane.
Okay. I'll show you kind of kinematic effects later, a little bit. And we haven't actually gone through exactly that to understand kind of how the change of kinematics would affect the loading on the patella in a very direct way, mainly because we don't have force plates and so forth to really understand kind of exactly how the force is being transmitted across the limb. So we can't really do that detailed biomechanical analysis. The question, and the same would apply on the frontal plane in this way. It's a very interesting question. To go through that analysis, but we don't have that kind of data to really go after it systematically.
And of course, the conspicuously absent vastus intermedius in your whole logic and description, or is it too weak to do anything?
So I will show you experiments where we replicated the study and with DI as well, vastus intermedius. And what we saw is that DI actually does increase like rectus femoris. Okay. Which is consistent, again, with the idea of minimizing medial lateral forces on the patella. That being said, VI is very, very small in the rat compared to humans, mainly because, it's a very small muscle. And that was actually one of the reasons we didn't do VI in these experiments, is that we didn't actually feel confident that we could record very well from it. But we now have developed techniques that we're confident we can get selective recordings from EMG and VI. And like I say, those later experiments are showing that it does seem to behave like rectus femoris in this pattern.
And was it at all possible to do the crossover experiment, something like paralyzing VM? That's one possibility. And another, I'm not sure if you can be that local using buttocks to transiently turn off only VL, but not other muscles. But I'm not sure if it's practical.
Yeah, so we had originally intended to do that, and we tried some kind of initial experiments. Both of those things were kind of in our initial goals. The trick with cutting the nerve to VM is so what's really nice about the nerve to VL is that the way that the quadriceps nerve comes in, it comes in medially on the limb, and then it kind of hits there's like a seam between rectus femoris and VM, and then the quadriceps nerves comes into that, and then it branches and innervates VM and innervates rectus femoris. And then there's a nerve that dives down laterally to get to VL. And what's really nice is that, at least from the anatomy, is that is a really long stretch of VL. that we could isolate and cut it and tie off both ends to prevent reinnervation in that way. And so we're confident that we could just get the nerve to VL in that way. Getting the nerve to VM is much trickier because it branches really fast and gets into all these different little fingers essentially going into the nerve there. So getting a separate cut to there, we really couldn't do it confidently and to interpret what's going on. But to inject that much Botox so that we could paralyze VL without affecting the other muscles or getting systemic effects, we weren't very confident from the literature that we saw that we could do that very well. And so we kind of avoided it.
Okay.
Yeah.
There is another question, but maybe you will address it later when you talk about movement kinematics, because the question refers to possible compensations from other joints, muscles in the overall change of the kinematic pattern. But I assume you will talk about it.
Yeah, so we have some things that will go to that point. Sure.
Okay, all right, thanks.
So great, thanks for all the questions, and please jump in, it's great. What we also did, like I said, was at the end of that 7 weeks, we went in and measured the muscle mass of these muscles, of the remaining quadriceps. And as I said before, VL mass dropped dramatically, consistent with being paralyzed. What we saw is that actually the mass to rectus femoris, it seemed to increase. It's a modest increase, but the mass did seem to increase at the 7-week time period. And so what it suggests is that part of the adaptation we're seeing is not just necessarily in terms of the neural control, but also in terms of the muscle mass within rectus femoris. Interestingly, we didn't see this change in VI, at least in terms of significantly. Although, like I say, we do see later on that VI EMG does change in the animals we looked at. It's a good question. I don't know that good question, I'm telling myself, it's a good question. Always a bad idea. But I don't know if we have the mass for VI in those other experiments as well, but it's something to look at. Okay. So, but this is saying that, part of this, even though the activation goes up and it comes back down, part of what might be coming back down is that the adaptation is happening because there's increased muscle mass in rectus femoris that gives us more force generating capabilities as well. Okay. So anyway, this does seem to suggest that we have something that looks like this, that there's a compromise between task performance and control of joint stresses and strains. So the animals seem to when you get rid of VL, the animals seem to preferentially increase rectus femoris activation in a way that doesn't really make sense in terms of regulating task performance, right? Because it would introduce this extra hip torque, but it does make sense in terms of controlling medial lateral forces at the patella. But importantly, we don't see this other condition here where the animals are really do strongly care about the joint stresses and strains, right? Because VM activation does not go down to 0. It basically stays where it was before this perturbation. And so it's suggesting that there's some sort of a compromise between task performance and medial lateral stresses and strains. And a relatively simplistic way of thinking about this in the kind of context of there's optimization and so forth, which we can debate whether that framework makes sense, but at least in terms of interpreting the results, the idea could be that there's a cost function that has some term that's in terms of task performance, maintaining joint torques or joint kinematics, another term that's in terms of minimizing stresses and strains. And what the nervous system is doing is basically finding a trade-off between these two different terms, right? So it's not completely optimizing task performance or completely optimizing joint stresses and strains, but it is getting some sort of trade-off. But the main point in some ways is that this cost function does seem to incorporate these stresses and strains in terms of how the nervous system is choosing muscle activation patterns. Okay. So what you're saying, if this is true, right, then the animals should have somehow deficits or changes in terms of joint kinematics, right, because it has this extra hip extensor torque. So the first thing it's saying is that rectus femoris increases. Do we see compensation in other muscles that might give us change in the hip extension torque to compensate for this extra rectus femoris activation, right? So we looked at activation of other muscles that had a extension torque at the hip joint, right? Either biceps femoris or semimembranosus. And what we see is that although there is a short-term, this x-axis is, the first plot is the baseline condition, and then week 1, week 2, and then week 7. And what we can see is by the time we get to week 7, when there's this persistent increased activation of rectus femoris, there's no significant change in either semimembranosus or biceps femoris posterior to kind of compensate for that extra hip flexor torque. So we couldn't find a signature of a change of EMGs, of hip extensor EMGs that would compensate for that extra hip flexor torque to minimize that that adaptation strategy, to compensate for that strategy. And what we saw is that animals did have a persistent change of joint kinematics after this adaptation, right? So this is just plotting sagittal plane kinematics. Caveat, kinematics in the rat are always a bit of a, I guess, to some extent, they're always very inaccurate. The skin of the rat slips a lot over the skeleton of the rat. So these are going to be relatively not necessarily the most precise in terms of exactly telling you where the skeleton is, but they give you some idea of what the limb is doing. And what you can see is that if you look at your baseline kinematics, this is the configuration of the limb at the end of the stance phase. We also looked at different points in the stance phase and saw similar results. And then if you look at week 7, this stick figure is in yellow, and then the black is the baseline condition, just so you can contrast the two to each other, okay? And what you can see is that there's a small change in the hip angle, which is consistent with an extra hip flexor torque, right? This increased activation of rectus femoris, right? And you can see that here in the hip angles. This is the hip angle at the end of stance. And you can see that basically that if you have initial joint angle somewhere around 95 degrees or something at this point of this cycle, it changes. It becomes more flexed, weeks 1 and week 2, comes back week 7 a little bit, but remains flexed relative to this baseline condition, okay? And then we can see that there's also changes in the other sagittal plane angles. The knee angle comes back to be not significantly different from what it was in baseline, but there's a change in the ankle angle here that you can see at the end of this time period as well, okay? So the idea is that the animal has a new kinematic strategy in terms of the limb kinematics, at least in the sagittal plane that we're looking at, right? So the animal, this is consistent with the idea that the animal is willing to allow changes in their task performance strategies at the level of individual joint angles in order to minimize stresses and strains at the joint, okay? But this is at the idea of each individual joint angle. If we look at kind of more global kinematics, so the kind of things that Yuri and other people have looked at that kind of describe kind of more global joint angles. So this is, we take a limb angle, a limb vector angle, where we take the angle between the pelvis and the hip to the contact point of the toe at the ground. And we just look at the length of that vector or the angle of that vector. And what we can see is that at the end of this adaptation period, animals return to a limb length, kind of a strut length that's similar to baseline levels, and a joint angle, this is at the end of the stance phase, that is quite similar to what they had before the perturbation. And we looked at, again, different points during the stance phase and saw similar results that we're seeing here, okay? So the idea is that the animals are willing to kind of sacrifice these local kinematics of joint angles and preserve global joint angles in this kind of way, right? So basically the idea is that, yes, the animal is willing to compromise task performance to control and to regulate joint stresses and strains. But from the point of view of these global angles, there's really no sacrifice in terms of task performance. The animal is able to restore those global kinematics. And in particular, you can see that the idea is that these changes at the ankle are able to kind of work with the changes at the hip so that the overall limb vector length and angle are preserved after this perturbation, okay? So what I just kind of talked through are kind of our 3 experiments that seem to suggest that, at least in our rat model, that the animal does care about these stresses and strains between joints. In our first experiment, we showed that the correlation between VM and VL is very high, consistent with a control, a regulation of minimizing the medial lateral force on the patella, and that this correlation is higher than the correlation of either of these muscles to VI or to rectus femoris. So it's saying that the easiest interpretation of this correlation is that they're minimizing the medial lateral forces on the patella. We show that if we put on a lateral load on the patella, the animals change the ratio between VL and VM in a way to compensate for that extra load. And it's consistent with this idea of controlling stresses and strains. And then we showed in this last experiment how the adaptation strategies the animals use after vastus lateralis paralysis by preferentially increasing rectus femoris to compensate for this loss are consistent with the control of these medial lateral forces on the patella. And I think, this last experiment was this was our kind of initial experiment. in this kind of this process, and I think these other ones kind of go after it a little bit more focused. But I think what's nice about this last one is that if we didn't think about stresses and strains in the joint, then this adaptation strategy we observe would be very counterintuitive, right? You know, from the point of view of restoring task performance and restoring the task, why shouldn't animals increase activation of vastus medialis? That would be by far the easiest way to do things, right? And instead, if we saw this increased activation of rectus femoris, we would have to start thinking about, okay, why would rectus femoris be different than VM, or what are the extra things being involved, right? And I think this is potentially kind of highlights why thinking about stresses and strains can be helpful in terms of understanding neural control strategies under normal conditions, right? That we really need to consider these extra variables, these extra kinds of factors when thinking about baseline activations of muscles, as well as especially how they adapt after perturbations and so forth. Okay. So
actually two quick questions. One is more technical. It's from Luis. After 7 weeks, how was the patella? Was there any sign of injury?
So we didn't. It's a really good question. We just looked at gross markers of problems at the patella or in the joint in general. These muscles, we focus on the patella because it gives us a relatively easy way to kind of interpret things. But of course, these muscles will also affect stresses and strains between the femur and the tibia as well. So we just kind of did the dissection and looked at the surfaces there. We didn't see any obvious inflammation or kind of reddening or any kind of damage that we saw there. But that being said, we didn't do a very sophisticated analysis. We didn't do a micro CT to kind of look at cartilage thickness, or we didn't look for any kinds of immunostains to look at kind of signs of inflammation, inflammatory responses, and so forth. This is something we need to do as our next steps, is to kind of look at, okay, what are the actual consequences of these kinds of perturbations, and to either good adaptation or poor adaptation and so forth. So it's a really good question, and it's a weakness in what we've done so far.
And I'm not actually sure that your results of your third experiment are that much supportive of your idea. The lack of a drop in VM activation to me suggests that the central nervous system either doesn't care about the lateral resultant forces acting on the patella, or there is an extremely flat optimum so that it tolerates quite a wide range of those without really doing anything to minimize them. And your final observation that the global factors such as the leg length and leg ankle, they may suggest that the adaptation happens, the control remains the same. It is referent coordinate of the endpoint of the foot in external space, well, with respect to the body, of course. And the rest adjusts because there are obvious anatomical constraints, and as a result, joint excursions may start to differ. The endpoint is driven by that referent coordinate changes during step cycle, but the joint configuration differs because one of the muscle misbehaves and doesn't produce forces that are expected. But it's still driven by the motion of the referent coordinate or the endpoint. So I'm just wondering whether there is anything that would tell us that really the lateral force acting on patella matters. Okay, yes, there was no increase in VM activation, but I would definitely expect a decrease, at least some decrease, and there was no trend towards decrease. At first, there was actually an increase, and then it drifted down to about the same level.
Yeah, so I accept a lot of most of what you're saying, that this is, it's one experiment. But like you say, I would have expected to see, if it were simply that you were that the nervous system was regulating behavior at the level of the task performance and, the referent variables in terms of a global joint angle or something like this, that I would have expected to see a change of VM as well as rectus femoris. The fact that we only saw a change of rectus femoris is consistent with our hypothesis. I'm not saying that it necessarily proves it, but it certainly is consistent with that idea. If we had not seen a change of rectus femoris, it would have disproved our hypothesis, right? So I think from that point of view, it's supportive. I think, I showed you the example with an increase of VM. We saw other animals with a decrease of VM. It seemed to kind of change both ways, that we could see either pattern about alterations there. I agree that we kind of did expect to see that VM would go down. But I think our interpretation is along the lines of what you're saying, is that essentially there is some sort of a satisfaction rather than optimization. There's a satisficing. Thank you. Where it basically is saying it's good enough, and it prefers to and especially in the context of other adaptation studies, which kind of suggest that the nervous system prefers to keep the strategy it had before the perturbation, that it essentially is lazy, and so that's kind of what we're seeing here. But you're right. I think all things being equal, if VM had gone down, it would have been stronger support in terms of what we were saying. That being said, that's one experiment, right? So I think our second experiment, where we put the load on the patella, that's a little bit more direct evidence to suggest that the nervous system really cares about this medial lateral load, right? So the animals, this is something that changes the load. We see the change of adaptation between these two that we would expect. The same thing in terms of kind of the baseline levels of correlations between these muscles, which are a lot easier to interpret in terms of the control of medial lateral forces, etc. So I think it's really between taking the three experiments together that as a body, I think they provide, not necessarily definitive support, but certainly strong support for this idea. So I don't know. Thank you. Cool. Any other questions at this point?
Well, there are a couple more questions. Oh, okay. But someone is speaking up, so please.
Matt, yes, just a clarification. I just wonder, for example, during curvilinear locomotion, vastus medial, those two muscles become differentiated, or are they still synergistic? For example, lateral and medial gastrocnemius become really different when you turn to the left or you turn to the right.
So we haven't done that in these experiments, in these rats directly. This is something I think.
Curiosity, because it is task dependent, or.
So when we've done, to the extent that we've looked at those kinds of things, again across different task conditions, or on kind of trial to trial kind of variations, we don't see that kind of differentiation between them, right? We see these kind of strong correlations between them throughout, across from one task condition to the next, as well as from step to step. And that's what we would predict, at least based on the mechanics of these muscles, right? Because when we stimulate them, they give us the same activation patterns. I think this might be different in humans, because in humans, especially when the limb is in extension, the patella can float. And so if you activate one of these two muscles, the patella will move. It'll translate, moderately, and that will actually result in a differential transmission of a torque to the tibia, right? And so that in that kind of context, these muscles will have differential contributions to task performance, and so it might change when you're making cutting movements and so forth in this way. But it's a bit of a question. I think we haven't looked at it in these animals, and to get that level of making the same kind of rapid changes of direction in a rat model would be a little bit trickier to do. One of the things we wanted to look at is kind of landing. If we could take these animals when they kind of land from a jump and look at that kind of behavior when there might be a very strong load, and look at that whether there be a change there or not. So in our task conditions, we haven't seen that kind of differential activation. Okay, so what I'll talk about in the last part is just more recent experiments, and they're preliminary, but it's kind of asking, how does the nervous system actually accomplish this, right? So, I think the idea is that, if you will, go with our supposition that the nervous system does care about these variables. And the question is, how does it actually care about them? How does it actually control them? How does it actually monitor them, and so forth, right? And there's a few different kinds of ideas for this. So how does this kind of coordination between VM and VL take place, or this regulation, right? So one idea would be that there's joint afferents within the joint. These could be within the ligaments. So the ligaments are definitely innervated, potentially in the bone as well. That could give you some sort of pressure, although evidence for that is not very clear. But that could be ways that there could be direct sensation of the stresses and strains within a joint, which could be fed back to the nervous system and used to change muscle activation patterns to regulate stresses and strains. Another way you could think about doing this is that the nervous system might not monitor joint state directly, but it might do it indirectly through muscle afferents, right? So you could think about if you had like Golgi tendon organs or spindles within your quadriceps muscles, and you kind of understood how those muscles affected the medial lateral load on the patella or stresses and strains within the joint, then you could indirectly estimate stresses and strains within the joint by monitoring muscle proprioceptors as well, right? And so that would require the nervous system to understand something about the mechanics, the relationship between your muscles and stresses and strains within the joints. But that would be another way to monitor these kinds of structures. And, there are some of the reflex patterns that people like Richard Nichols have looked at in proprioceptors are consistent with this idea that maybe you could interpret some of the results they've seen in terms of force feedback pathways as being consistent with controlling medial lateral forces on the patella. Another component that could obviously be involved that would be something outside of reflexes, which could be part of just the feed-forward pattern of activation, right? So in particular, the correlation between DM and DL might be mediated through presynaptic networks, which project to both motor pools and really define in kind of a hardwired sense the correlation between these quadriceps muscles that will maintain the medial lateral force between the patella. And then you could think over adaptation. What could happen is that the nervous system might change the gains to these different motor pools or the projection strengths of these different neurons to give you to change the balance of activation between these pools. Okay, so these are kinds of the things that we're trying to get at next. The experiments we've done so far are trying to get at the role of joint afferents in these experiments. Okay, so joint afferents have been studied a lot, and they remain kind of somewhat mysterious, I think, their role. And there was lots of controversies about them in the 70s and 80s in terms of what they can actually tell you about the state of the limb. But in the context of kind of what we've done here, we're doing here, there are results that suggest that they could play a really important role in the control of movement, right? So these are experiments done by Baxendale's group. So they just put local anesthetic, lidocaine, into the knee joint of these animals. And they showed that in some animals, they had really profound changes, not profound, but really striking changes in limb kinematics. So this is a case where the animals, after you put the lidocaine into the knee joint, they lost the extensor tone in their ankle muscles. And so basically the animals no longer, although in the intact, they usually will have their foot on the ground, their paw on the ground. After you put lidocaine in, they put the whole foot pad on the ground instead. And they would have buckling at the knee joints, buckling at the joints and so forth, right? So relatively strong changes in task performance when you put this kind of perturbation. Then there's other studies that have kind of looked at what happens when you get rid of joint afferents, and showing that you get increased osteoarthritis after joint denervation. So this is work from Salo, where they got rid of the joints with the joint afferents within a joint by just basically killing them, and showed that in the joint that was affected, you would get more osteoarthritis. And this was over the course of months. So this is when the animals got old, you started to see these changes of osteoarthritis. There's also experiments by O'Connor, as well as more recently by Jelly and others, where they kind of suggest that you only get osteoarthritis after you get rid of ACL, right? So the idea is that you only kind of compromise knee performance when you get rid of denervate the ACL, right? And so the idea is that afferents in the ACL might be important in monitoring or signaling the strains within a joint. And when you get rid of that afferent information, then you develop osteoarthritis. And then others like Solomonov have shown that there are reflexes from the ACL, right? So if you were to electrically stimulate the cruciate ligament, ACL, you can get reflex activation of muscles, suggesting that there are reflex loops that will give you this control from sensory afferents in the joint back to the nervous system. But I think it's fair to say that in general, the role of joint afferents in either controlling stresses and strains, or more generally in terms of task performance, isn't very clear. And there's kind of evidence on both sides of this in some ways. So we just wanted to do this in a relatively simple way in our animals. We just went in and did kind of the same thing as the Baxendale experiments. We just went in and we give interjoint injections of lidocaine, and then compare that to the effects of a sham injection to see how that affected our behavior. We did some experiments where we recorded from the articular nerve in rats and showed that when we put lidocaine in, it's not, basically we're just tapping the knee joint right now and across this time, and we see no activation of afferents. If we wait 1.5 hours after we put the lidocaine in, we can now get a burst of activation of these afferents, right? So this lidocaine is able to shut down the afferents within the knee joint temporarily, okay, in this reversible way. So then we just looked at how this affects our animals and these behaviors. And we first looked at just normal behavior, normal locomotion, right? So this is just showing the limb kinematics. So pre is in black, and then orange is showing us in post. And we see no difference between stance and swing phases or the step duration. So no gross changes of kinematics. And we didn't see any significant changes of joint angles either global angles or local angles or anything. So overall limb kinematics, we didn't really see much of an effect. So we really didn't see the dramatic changes that Baxendale was showing in their cat experiments. We also didn't see much of a change, or didn't see any significant change in the EMGs either, right? So EMGs, in terms of the mean activation across steps, did not change by putting lidocaine into the joint, right? So basically what it looks like for normal task performance, joint afferents really do not seem critical. They don't seem to be affecting our control of our EMGs in a direct way. Okay. So then we looked at more closely at the kind of this VM-VL correlation. So if this correlation between VL and VM is being driven by afferents that are telling us the state of the medial lateral force on the patella, and then that's being fed back to the spinal cord or other places to change the activation of VL-VM, we should see that correlation should be disrupted after we put lidocaine into the joint. And we didn't see that. So this black is showing the correlation between VM and VL before we put the lidocaine into the joint, again, showing it's quite high. We put lidocaine in, there was no significant difference, okay? But what was kind of interesting and nice is that we did see a change in the correlation between other muscles. So VM to VI or VL to VI, this correlation went down after we put lidocaine into the joint. Okay, so we don't really have a clear interpretation for why that's happening. We could kind of make up some stories, but we don't. This is unexpected. But what was nice is that it gives us at least a positive control to show that the lidocaine was getting into the joint and affecting something, so that it was changing the coordination between these muscle activation patterns. But it wasn't changing our primary outcome of the correlation between VL and VM. And notice also that this decrease of correlation that happened between these muscles happened at the same time that the mean activation between the muscles did not change, right? So even though the mean activation of the muscles is going on as before, we're seeing a change in somehow the trial-to-trial variation between these muscle activation patterns. And then just as a control, our sham injections had no effect on these correlations whatsoever, okay? So what it kind of suggests is that
Matt, excuse me, a very technical question comes from Mindy. When exactly was it measured?
These were measured, I believe they were measured, we gave the injection, and then we waited, I believe it was 20 minutes after the injection. And all of them were taken within, I think, the hour of the injection period.
Okay, great, thank you.
Sure. Okay. So then that was the kind of coordination during normal behavior. And then we went in to look at how joint afferents might play a role during adaptation after VL paralysis, right? So the idea here is that, we're going to cut VL, right? So in the intact conditions, there's no aberrant medial lateral loading because the nervous system is regulating patellar forces correctly. But when we paralyze the muscle, that might cause an aberrant load on the patella. And it might be only in those cases where we get this really strong perturbation to the system and get this really strong change of the load on the patella, that joint afferents might then come into play when we cause that initial change, right? And so what we wanted to see is whether the sensitivity of the animal to these lidocaine injections changes at different time points across this adaptation process, right? So with the same kind of idea, we put lidocaine into the joint and see how EMGs and kinematics change. Okay. What we saw is that there essentially was no change of EMGs, right? So this is a case where we have, again, we have VL in our baseline condition. We then cut it, get rid of the activation of VL. And then at each of these time points, we're doing injection. We look before and after the injection. And you can see in baseline conditions, again, lidocaine has no real effect. After, at week 1, week 2, week 5, even though there are some changes, little small changes, they weren't consistent across animals, and they weren't consistent across time points, right? So, rectus femoris, this is the largest apparent change, but it changes in one direction at week 1, it changes the other direction in week 2, and it was not consistent across animals, right? And this is just summarizing this, right? So these are the activation of the VM, VI, and rectus femoris, either in baseline conditions before the paralysis, week 1, week 2. We only went out to week 5 in these experiments. That's kind of when adaptation seems to be significant at that point. And at none of these time points did we see a significant difference in the activation of these muscles before or after lidocaine. Okay, so the basic comparing the black to the red bars shows that there's really no consistent effect of lidocaine across these time points. Notice that we replicated our result from the previous one. There's no net change of VM at week 5 compared to baseline. There's an increase of rectus femoris from baseline to week 5. And then what we saw again is that what I said before is these animals, we had VI recorded, and we saw an increase of VI from baseline to week 5 here, okay? So that just adds it replicates the previous result and then adds that extra data point for VI. But the main point here is to say that it seems like lidocaine shutting down joint afferents did not reveal a new effect of joint afferents, especially in these acute periods of the perturbation when there's a very strong aberrant load on the patella in this way. It looks like afferents don't motion. Normally EMGs are joint kinematics. They don't seem to be important for driving the correlation between VM and VL. And they don't seem to be important in kind of the changes of the EMGs that might be caused by an aberrant load on the patella, okay? Notice that we can't talk about here is whether joint afferents might be important in driving the adaptation independent from driving a reflex change of EMGs. So we don't have an experiment for that. That would involve a more chronic deafferentation of the joint and looking at how adaptation is affected. And we haven't done those experiments. So that's kind of a missing data point in the story. But it does suggest that joint afferents don't seem to be critical in driving a lot of what we're seeing in these, at least the regulation of these muscles underlying the regulation of joint stresses and strains. Okay. So one of the things we wanted to look at, our next step, so that's all kind of the primary data. And then our future direction is to look at the role of muscle proprioceptors as well as spinal interneural systems in this, right? And so there's some really interesting work. I don't have the slides up to talk about it, but from Elie Zelzer in the Weizmann Institute. He's looked at animals that have proprioceptors knockouts. Okay, so he can do genetic manipulations of mice to get rid of Golgi tendon organs and muscle spindles. And he shows that these animals, when you get rid of them from birth, these afferents from birth, end up with very striking joint deformities. So in particular, these animals will develop scoliosis, really striking scoliosis, as well as hip dysplasia. And so suggesting that at least that one idea is that muscle proprioceptors might be very important in kind of giving the coordination patterns between muscles responsible for regulating these stresses and strains. And so that's one of the things we want to try to look at. We're trying to do a collaboration with him to look at his animals and see whether some of the signatures that we see in our experiments that reflect the control of joint stresses and strains are compromised in animals that are missing muscle proprioceptors, either Golgi tendon organs or spindles or both, and seeing whether those coordination patterns are kind of compromised. The other thing that I think is certainly interesting is looking at spinal interneural systems that are involved in this, and in particular for the VM-VL correlations, right? So, people have described, so people like Ariel Levine have talked about neurons that are involved in kind of synergy encoding neurons, and there, they seem to activate groups of muscles simultaneously. And so the question would be whether there are interneuronal populations within those neurons that she's identified that might give us a presynaptic drive to VM and VL, preferentially compared to VM and VI or VL and VI, and whether we can find interneurons that have a signature of the coordination that we see. And then, what's I think nice about this paradigm is that we potentially then have predictions of what kinds of sensory information those interneurons should be receiving, either from joint afferents or from muscle proprioceptors. And then we can then say how those things might change under different perturbation conditions. If we put a load onto the patella, if we paralyze a muscle, we have predictions in terms of how the nervous system, the neural circuitry might evolve, might adapt, that would be consistent with the control of this kind of stress and strains within joints. So those are kind of the next steps that we're trying to shoot for in terms of taking the story out. So just acknowledging, again, most of the experiments were done by Cristiano and Philippe in the lab as part of as postdocs. There were also experiments that people helped out. People like Ben Rellinger did some of the initial VL paralysis experiments. David Tentler, Sivan Ye, and Adarsh helped out with some of the experiments. These are also collaborations with Tom Sandercock and Yassine Dar. Yassine, when he was in Chicago, he's now in Texas. As well as Dinesh Pai and Chi Wei, who helped out with some of the biomechanics analysis and so forth. And this work was funded by NIH as well. So happy to entertain more questions, but thanks a lot for your attention and participation throughout.
Okay, Matt. So I'm going to give you a couple of questions received recently, although if people want to speak up, please do. So the question was, is there may be a difference in peripheral nerve lesion effects and UMN? I assume it's upper motor neuron lesion. I wonder whether the joint force, I'm also not sure what it means, maybe whether it's joint compression force or joint momental force, was measured in this study to justify rectus femoris and vastus medialis activation. So since the question is from Selva Ganapathy, and I wonder whether Selva could maybe unmute yourself and speak up and clarify the question.
Yeah, actually the whole point is to safeguard the joint. I mean, to optimize the forces happening to the joint, knee joint. This muscle activation has been happening, right? That's the whole idea of this study. But to prove that, we need to measure the forces, like if any way we can joint compression or something, or where which part of the knee joint, medially, laterally, which portion is getting actually getting this strain or sort of thing like that. So that part is not measured in the study, I guess. So in that sense, how can we say this is to protect the joint? This activation has been taken place.
So it's a great question. If there were a way to actually measure the forces within the joint, it would be fantastic. The problem is, of course, that that's next to impossible, right? So I think, I saw BJ Freely on this as well. I mean, he, has the fantastic experiments with the, where he has the measurements from an artificial knee joint, and there's the knee joint challenge, where people try to estimate those contact forces as best as possible. And that's an ongoing challenge. It's quite difficult to do. And that's in the case where you actually have an artificial knee joint. In the case where you have an intact animal, it's really next to impossible, right? So there's really, and I think to a large extent, that's been one of the main reasons that these kinds of considerations have been so difficult to talk about, right? Because our access to them is often only through simulation, right? You have to have, very complicated, very sophisticated models of the joints to understand how change of muscle activation would change the stresses and strains within the joint in a systematic way. And those models are very difficult to validate and to actually, to ground in reality. So I agree entirely, like to really kind of connect the dots in our study, we would want to be able to say that, yes, when you preferentially increase rectus femoris, that results in a less medial lateral force than you would expect if you increase the DM, right? Our conclusions for that are really based directly on our other biomechanical experiments where we had to dissect out the patella, measure the forces and so forth. but we can't do that during natural behavior. One of the things we want to do that could be very exciting is we're talking with kind of, again, part of the collaboration with Ellie Zelzer, is that we might be able to do, obviously one way you could think about doing this is if you could insert a pressure film into the joint and then kind of put that in there, measure how the pressure is distributed, pull it out, and then you read the spatial distribution of stresses on that film. Obviously, that's really, again, next to impossible, because to do that, you have to kind of rip the joint apart to put it in there. But one idea could be is that could we use biomarkers as a signal to give us stresses and strains indirectly, right? So if we were to look at, if you have an aberrant force on the cartilage, if we understood the signaling pathways that kind of go from that increased force to degradation of cartilage or inflammatory responses, and if we understood kind of what was the immediate signals that were involved with that, could we use those biomarkers essentially as a natural pressure film to understand how these things change? And so that's one of the things we want to try to look at is, can we use that kind of readout to estimate stresses and strains, at least qualitatively, within a joint, to see how different adaptation strategies affect those contact forces in a direct way.
And I think you will be agreeing to this, like these experiments are on, we cannot correlate with human studies, I guess, because we are bipedal walking pattern. So that will, the experiments are on rat. So the walking style, everything would be different.
Yeah, I mean, I'm not trying to say this is a model for humans. I think what the point for what we're trying to say is that the rat is actually, it's kind of the, the arguments of, animals as good models that you can take advantage of their particular patterns to highlight and come up with very, clear predictions of experiments, right? And so I think what's nice about rats, which is different than humans, is because of their crouched postures, the patella is really locked into the femur, and this allows us for this really clear distinction between task actions and joint actions. In general, again, I think part of the reason that it's often really hard to study these questions is that in most cases, if you do a perturbation, like paralyzing a muscle or, putting something that affects the joint, those things will also affect task performance, right? So like if you were to cut a ligament in the joint, that will cause aberrant stresses and strains within the joint, but it's also going to change the way you produce the task, right? The way forces are transmitted across the joint as well. And so I think that the nice thing about using this kind of, the way we did it, is that it allows us to come up with a relatively clean kind of predictions between these two that allow us to interpret results that might otherwise be difficult to interpret. At least that's kind of my argument.
And I think in humans, that behavior aspects will come in. Like a person would prefer to avoid weight bearing. Generally, if any injury happened to the limb, we tend to avoid weight bearing to that joint. And we totally change the mechanism of the muscle action by our preference, right? I think it will vary to individual to individual.
Yeah, we don't know. I mean, so we did see some patterns, like I said, like VM changes seem to not necessarily be the same across animals. All animals seem to have a preferential increase of rectus femoris. But there was some variability. And, when we put the load on to the patella lateral, they seem to do the same things. So, I mean, there are plenty of studies to suggest that animals can do individual variations as well. But we didn't, see the same kind of dramatic. I think in some ways, this is even though it seemed, I was thinking paralysis of VL would be like a really, a pretty significant perturbation to the system. It seemed like animals adapted to it pretty quickly. Which was kind of surprising to me. This isn't I think at the level of actually having an ACL cut, that might be a larger perturbation. The other thing that kind of plays into all of this in a really tricky way is pain. And that's a really hard thing to kind of get at. And in human injuries, obviously, you'll have the change of the mechanics that will be caused by like a ligament rupture or something. But there's also that really traumatic pain that you get right at the time of the injury itself. And those, so how are the individual strategies you see, are they a response to pain avoidance? Are they a response to the change of mechanics or, some combination? It's really hard to differentiate all those things, especially in humans, right? Because you can't really control them separately. So, we've done some preliminary experiments where we've done ACL cuts in rats. And there we can begin to, so we at least have a model for that. But we might be able to kind of, along as our IACUC approves, talk about how that the change, either eliminating the initial pain that's associated with it, that cut, or suppressing it, and whether that changes adaptation strategies and so forth. Might be very interesting to look at.
But it's an interesting study, and it was beautifully presented. So because
there's lots of caveats, and I hope I've not tried to overinterpret the results, but I appreciate the caveats, definitely.
Matt, there is a question from Xiaofeng Sheng. Is there any evidence showing that the central nervous system controls joints in a gradient way in which proximal joints are mainly feed-forward driven centrally, while distals are more heavily feedback manipulated?
It's an interesting question. There's work, there's some idea that, not so much in terms of joint stresses and strains, but in terms of just kind of like CPGs and so forth. There is some idea that, CPGs at the proximal muscles are more, there's more of a central drive at proximal muscles, and there's more kind of peripheral kind of reflex control as you get more distally. And so some of the work kind of people like Keir Pearson kind of suggest that, as well as things like Jerry Loeb's work, where they looked at kind of the reflex structure of, or kind of the control of distal muscles versus proximal, and show more stereotyped kinds of control of proximal muscles across animals and more kind of individuated control of distal muscles. So there are some indications that might be the case, but I don't know that it's really been definitively shown in any direct way. There certainly are reflexes at all of the joints, but to what extent you rely on feed forward versus feed back in each of them isn't quite so clear, at least to my knowledge.
Okay, I'm not going to read any more questions. So if you want to ask your questions, please just unmute yourself and speak up. And meanwhile, maybe we can return to the issue that Anatol partly alluded to, and I also partly alluded to, with the idea of global factors such as the referent coordinate trajectory in space for the limb being the main driving force. But then there is also this sharing pattern of efforts off the plane that, like in a medial lateral direction, for example, on the patella, that favors certain patterns of sharing of joint action among agonists, among the foreheads of quadriceps, for example. And that most of the things that we see is not requiring much more than that.
Yeah, I think that's certainly possible. I'm not quite trying to say that everybody needs to stop what you're doing and study joint stresses and strains, and that's the only game in town. I'm not trying to say that. I'm trying to say is that these are a set of variables that I think I personally overlooked when I think about motor control, and that kind of came out from studying the mechanics of the limb and looking at literature. And I think it is, it's something that, especially when we start talking about questions about redundancy or, extra muscles that you don't, why do you, people have kind of said, why do we think about VM and DL? They should just be one muscle, right? And if we just conceptualize the limb as being one muscle, VM and DL just makes our life a lot easier. Our distinction between these two is just an artifact of the anatomy, et cetera. And basically the nervous system, the biology is just packing muscle tissue into the limb. Some of it needs to be medial, some of it needs to be lateral. It's just one muscle. And I guess I'm just kind of trying to say that, that maybe that, that's certainly a possible kind of thing. But when you start looking at some of the details and thinking through kind of how these muscles go, the actions of these muscles, how they affect the state of the limb, there might be extra things to think about that you wouldn't necessarily think about when you just say, go grab an object or walk from point A to point B. And so there might... Of
course, quadriceps is not just a single muscle. Of course, we have several heads for a good reason, just like we have several heads in our finger muscles, extrinsic finger muscles, for a good reason, to be able to do more than just using the hand as a single degree of freedom manipulator. And maybe the balance of forces and torques, I don't know, in the orthogonal directions to the main line of action may be a very important factor, of course, in all that. So no, there must be a reason.
And so the other thing I can think that's potentially something that'd be really fun to try to look at, I think it's a potentially attractive idea. I always kind of am really fascinated by why do we have the muscles we have? So if we were just doing a robot, right, we just have a single actuator on each of our degrees of freedom, and we could do whatever we wanted. But instead, we have these really weird multi-articular muscles. Sometimes we have things that act, like in the rat, there's no pure knee flexor muscle. It's always a bioarticular knee flexor with something else. And so why do we do that, right? And one idea that I think could be really interesting to look at is that perhaps the anatomy of the muscles are kind of set up so that if you only try to control task performance under normal conditions, you get balanced joint stresses and strains kind of for free. So think about kind of VM and DL, right? So they're giving us, opposing medial lateral forces on the patella. If you just are trying to optimize, produce a knee extension force, knee extension torque, right? And you want to do it in some way that minimizes something like your activation squared. So something like an energy cost or something like that, or you're doing something like a Wolpert, Harrison-Wolpert idea of minimizing endpoint variance or something. What you're going to end up doing is you're going to distribute muscle activations across muscles. And that's going to, rather than just activating one muscle more and more, you want to try to, you want to avoid large activation of any given muscle. What that's going to do is cause basically sharing of activation across VM and DL, which will give you essentially a balanced activation between DL and DM for free. So there's nothing that you did in your control strategy which actually paid attention to the medial lateral load on the patella, but you end up minimizing the net medial lateral load on the patella because of the anatomy of the musculature, right? And then, that doesn't explain what happens when you have perturbations, right? So if you put a load on, then you need an extra system that would care about those variables when you have those really aberrant situations like injury or something. But under normal conditions, it might be that the muscles are configured in such a way so that for the types of tasks that we normally do, you kind of get these minimal stresses and strains with the joints without actually actively controlling them. So I don't know, that's a kind of a possibility. And you can kind of see muscle anatomy that works along these lines. So you often have muscles that will kind of cause a, pronation and supination across like the tibia or the femur that are kind of acting in direct opposition to one another. So the anatomy is kind of set up to do that in some cases. Other cases, it's more complicated to kind of look at along those lines. But that's kind of in the background of my mind. That's something that would be really interesting to pursue, whether that is some sort of explanation for muscle anatomy.
Yeah, it's a little bit teleological to my liking, of course.
Yeah,
I think the evolution did it for us, I guess. Okay, so are there other questions? Please speak up.
Maybe I'll ask one general question, which came. So the knee joint is a specific joint; it's a hinge joint. I just wonder whether other, for instance, hip joints might have different principles of joint stress regulation.
Yeah, it's a really interesting question. I mean, in the rat, we do have, it's not just a hinge, it's kind of it has a rotation as well, pronation, supination at the tibia, so it's a little bit more complicated. But yeah, whether like a ball and socket joint, like at the hip, if that has a different control, or the shoulder. I mean, the shoulder, there's people like, there's a number of people who are looking at kind of these same kinds of issues at the shoulder joint. Obviously looking at kind of rotator cuff muscles. Obviously, the mechanics there are quite different. And maybe in those kinds of situations, what you care about is less about the loading and the stresses and strains, and more about less about the stresses and more about the kind of relative strains, And so, for instance, like the work that I described with that Ellie Zelzer did, they showed basically when you get rid of the proprioceptors, you have predominantly effect at the hip, but in their animals, they didn't see much of a change at the knee joint. And so, there might be more kind of proprioceptor-driven reflex control at the hip to make sure that the hip doesn't go displaced in the joint or kind of, extruded or, separated. And so you get maintaining that good opposition there, and that might be a different control strategy than at the knee joint. That's more in terms of what might be the sensory mechanisms that are involved with that. But you can also imagine that could be a difference between reflex versus feed forward and so forth between the different joints. At this point, I don't really have a clear logic for why one joint would be one versus another, but it's kind of an experimental question, right?
Did you plan to do such experiments on other joints? No.
Yeah, so part of the collaboration would be to look at similar kinds of things like at the hip joint. The trick there is that, along the lines of what you're saying, is that the interpretation of the results is more difficult, right? Yeah. So, I think part of the work that Eric Perot has been doing at the shoulder joint kind of suggests that actually, usually we think about the rotator cuff muscles as being, really the critical ones in terms of stabilizing the shoulder joint. But what he's been showing is that it seems like actually some of the prime movers at the shoulder joint are equally, if not more important than those rotator cuff muscles at stabilizing the joint as well. And so then how do you start differentiating between a change the activation of do some perturbation, and you look at change of activation of muscles, interpreting that in terms of joint stresses versus task becomes a little bit tricky to kind of pull off. But those are experiments we want to try to look at. It's kind of differentially, can we look at different joints and do these types of perturbations and see whether we see different types of control strategies across them?
All right. Any other questions to Matt?
Maybe I ask a question and give an advice. Okay. One question is, are you going to actually record interneurons, spinal interneurons, as a continuation of your analysis? I would like to notice that what is pleasant about your system is that you can address basic classical problem in the control of multi-muscle system and so on. So I would suggest that I also and Mark talk about referent configuration of the joint or body as a whole. Thinking about what system could represent this kind of control, I'm thinking about propriospinal neurons, which terminate practically on all muscle of the body if you take together. And if imagine that these neurons receive information about actual configuration of system, of body or segments, subsystem. Okay, when this is a way to think that these neurons are responsible for global factor in the control of the multiple muscle. I intentionally pay attention that there is a global minima during locomotion for muscle you control, you record it. But I also noticed, maybe I'm mistaken, but this global minima is shifted during perturbation you produce. But in general, when you consider everything on mechanical or biomechanical level, it looks like the nervous system compute all these balances between muscle torques, EMG, and you, I would say, proponents of internal models would appreciate this and claim, this is confirmation of direct programming. I think it's a very false impression. I would like to inspire you to think in terms of more global factors in the control of this system. And so studying interneurons or even you can say start from simple lambda for single muscle, recording, say, in the cerebrated rats. And I like an expression of Michael Tormey, who said that lambda is scalable parameter across all systems. At single muscle, it's single lambda, but at more global level, it's referent body configuration. And so I think this language is very would be helpful. Okay, so maybe you take into account to slightly shift the approach based on your very unique system. Okay.
No, the point's well taken. I mean, I think I don't know that I don't know that I'll shift everything in terms of lambda hypothesis. I mean, with all due respect, but I mean, in terms of talking about things at the global level and understanding the balance between kind of a global control of the limb or of the behavior and how you balance that at the level into local variables is really a fascinating question to me. And I think I agree with you. I think this paradigm potentially allows us to look at that balance of those relationships in something of a tractable way. I don't know exactly what that framework is, but for instance, I think the bit about, this tension between saying you're willing to compromise local joint angles, but maintain global joint limb angles. And so that idea, and how do you do that control at the level of reflexes, while at the same time also maintaining kind of joint stresses and strains or minimizing those joint stresses and strains. How that's accomplished in a neuronal system mechanistically, for me, is fascinating. And, and I think that's part of my why I like this approach, because I've always been interested in the spinal cord, as kind of a place to look at, because I think it's doing a lot of really cool things. But it's really a kind of complicated to get at, right? There's so many different sensory afferents, there's so many different neuronal populations. And trying to understand things like locomotion in the context of, understand spinal cord in the context of locomotion. I think that there's, beautiful work that people are doing, but I'm just not smart enough to be able to kind of think through how different reflex pathways and different afferent systems should be kind of regulated in that to make really concrete predictions in terms of interneurons. Whereas this kind of paradigm, I think, of kind of quadriceps coordination and in terms of task performance, but then also stresses and strains, gives us a way to get kind of a handhold into neural circuitry in the cord to make predictions and to test hypotheses. So, for instance, like, I don't know if you've seen Andrew Brzezinski's work, where he's kind of looked at kind of the reflex structure, spinal reflexes, and how it kind of incorporates kind of global levels of the task performance, which kind of would speak to the global variables that we're seeing regulation. So what those systems might be, how they would incorporate stresses and strains within the joint, those kinds of things, I think would be really fascinating to look at. And I think, I don't, again, have a very clear, I think our first sets of experiments, if we go into interneurons, will be the relatively naive, simple ones, of kind of looking at what afferents do neurons get, where do they project to, how do they change under adaptation, things like that. But then opening it up to saying, like, how do you balance that with other regulatory systems in the core, I think would be really interesting to look at. But so I agree with you in principle. I just...
Yes, I agree with you, but it's very challenging. Of course, I'm not trying to simplify this transition, but I'm optimistic that your intention, at least, to move in this direction.
No, sounds great. Thanks.
Thank you.
Okay. Are there any other questions to Matt? Well, if not, let's thank Matt very much for the wonderful talk.
Thanks for all the questions.
Don't forget, this Friday we have a talk by Anatol Feldman. So if you want to know how it really works, you should connect this Friday at noon, and we'll see what we learned from Anatol this time around. So see you all, I hope, in a couple of days, and have a good day. Bye-bye.
Bye-bye.
Thanks, Mark. Thanks, everybody.
Thank you. Thanks, Matt.
Thank you.
Thank you, Mark.
Oh.